Hey, good afternoon, everyone. My name is Dee Lender. I'm the Executive Director of OARC. Welcome, and we shall get started. We are currently, as I see the numbers climbing, we are currently approaching 230 participants, and we will start. Thank you. Thank you for taking the time to participate in today's live webinar. A reminder that today's session is intended for people living in long-term care homes. By virtue of living in a long-term care home, you are members of your respective residence council. So we want to extend a very warm welcome to you and to those of you who have leadership roles within your home as residence council leaders. There will be a similar webinar offered tomorrow. Tomorrow morning, in fact, March 16th at 10:30 in the morning, specifically intended for family caregivers, co-hosted by Family Councils Ontario and the Ministry of Long-Term Care Pandemic Response. I want to say thank you to all the residents for joining us today and to your long-term care home team members who may have played a very important role in supporting you in your participation today. Thank you very, very much. While much of OARC's work is with our provincial government, today's session is the second webinar bringing together government decision makers and people living in long-term care homes across Ontario. We are grateful for these opportunities and extend a thank you to our ministry partners for recognizing the importance of ongoing communication, keeping residents well informed about pandemic-related changes. Before we get started, I wanted to share that this session is being recorded for education purposes, and it will be available on the OARC website tomorrow for those who might have missed it or if you want to review it again. You'll notice that we've muted participant audio in an effort to eliminate background noise and distractions. And we also have a protected time at the end of the webinar for a question and answer period. So at that time, we'll invite you to type your questions into the question box. If we're unable to address your question live today, a contact email for the pandemic response team will be shared at the end of our session. So I wanted to pause just for a moment and answer a question. Why are we here today? On March 9th, Erin Hanna, Associate Deputy Minister of Long-Term Care Policy and Pandemic Response, issued a memo to all long-term care homes in Ontario, advising them that as of March 14th, yesterday, some quite significant changes with regards to how COVID is being managed in your homes came to be. Any change at any time to directives, easing of restrictions, decisions made at the policy level of government, all of these things affect your life, your well-being, your experience in your home, with your team members, with your co-residents, with your family and friends, and your ability to participate in that rhythm of life that happens in your home, including visiting, leaving for absences, dining, activities, feeling safe and secure and well prepared to stand up to this virus that we've all been fighting for over 2 years. Oftentimes, I would suggest, there is a disconnect between the information you receive as residents and the delivery of the why behind decisions. OARC wants to provide opportunities for you, people who live in long-term care homes, to have audience with decision makers, policy makers, to have opportunity to explain how decisions affect you, and to have opportunities for you to share how you are feeling. OARC's culture is built upon respect and an understanding that residents are not a stakeholder or an interested group to be considered. You are the core. You are the reason for the existence of over 630 long-term care homes, and the reason that residents' councils are so critically important. So thank you very, very much for joining us today. Please consider the information presented today and ask lots of questions and express your views. And I want to remind you to please ask those questions utilizing the question box. So without further delay, I'd like to give a very warm welcome to our guest today from the Ministry of Long-Term Care. We have Christine, who's a director with the Long-Term Care Projects and Recovery Department, and Dawn, who's Director, Long-Term Care Projects and Stabilization. So over to you, Dawn and Christine.
Thanks so much, Dee, for both inviting us to be here today and also providing us this opportunity to speak directly to the residents. Just noting on the great success of the last webinar that we held in February, and a big thank you to all of the residents and the homes supporting the residents and joining us for today to provide us this opportunity to speak to you about the updates and answer your questions that you may have and how these changes really do impact you. Dee is completely right. It really is all about the residents, and we we remind ourselves that every day. Remind's probably the wrong word, but we think about that every day as we are doing our work. And so it's a great opportunity for us to truly share with the residents and also receive feedback through the questions and answers that you asked today. Next slide, please, Melissa. So why the change? There's 3 points on here, but we are seeing just the trends in numbers of cases and outbreaks throughout the long-term care sector continuing to improve each week. And we're also seeing the government easing the measures across the province, including the long-term care homes. But what's not on here that I do want to speak to is an important point that even when the numbers were higher, I'm very happy that we are seeing the numbers decrease in the number of cases. A strong measure that we were closely watching was the number of residents who are asymptomatic with COVID-19. And that number is approximately 60% of residents, and most residents who do have symptoms were mild symptoms. And so that was important for us to understand and really helped us in making our decisions about what is the next step as we continue with the easing of measures. The other important thing is really, as the province is easing up the measures and returning the rest of the province back into a level of normalcy, it's important also that we provide that opportunity to yourselves, the residents of the long-term care homes. And so not just about a level of normalcy, but also just striving for that better quality of life for you. And so being able to socialize with your friends, go out with your family members, have people come in and visit, those are all important aspects and something that we wanted to make sure that we were giving the residents the opportunity to do. One note is that we set provincial standards, and it's really, there's times when the homes for operational reasons may need to put in something that is stronger than what the ministry has put in place. And we really are encouraging the homes to be working with the resident councils to make sure that they're understanding what are the feelings of the resident councils if something stronger is being put in place. Also, all of these measures are when a home are not in outbreak. If the home itself is in outbreak, then all of these, the measures within a home are actually under the public health unit to make decisions on that. And that just really comes down to looking at the individual need of a home, the different circumstances of an outbreak, and making sure that the residents are being safe and trying to stop the spread of COVID-19 in a home if an outbreak situation is in place. So with that, next slide, please. Well, I'll just walk you through a few of the changes, and then I'll turn it over to Christine to speak further to some changes. So for yourselves, the residents, participating in social activities is a big one, and we're hoping all homes continued with social activities throughout this pandemic. But now we're really being specific that there's no cohorting requirement at all, and we are only expecting for the residents to be cohorted when they are dining. So hopefully this means that residents will be able to go across units, across floors, visit with their friends throughout the home, recognizing that not everybody you know and want to speak to is just within maybe your little unit. So that's one of the first changes. Another one that is a big change is the need to not physically distance from each other. And so when you are speaking with your friends, you can be in a closed group. We are recommending that while you're not physically distancing within a group, between groups, and same with at the dining tables, between the dining tables, there be some space so that there's not overcrowding happening. And that actually brings to the next one about having bigger groups for social activities. So we previously tried to keep the number at not more than 10 people, but now the ministry's not putting a number on that, recognizing every home is different. And we really, the messaging to the homes was about crowding. Let's not overcrowd a room. Let's make sure that there is space in a room. But again, you don't actually need to be physically distancing and can have those bigger social activities, including residence councils. We had a webinar for the homes on Friday of last week, and we made the important point of the importance of the resident councils. And so this is one that really falls into that, where homes should be making sure that those happen. And the last point on this slide, a very important one, is that all residents can now go on all absences. And so there's no restrictions at all. If a resident wants to go on a day absence or overnight absence, they should just work with the home to do so. Next slide, please. So visitors coming into the home, we've made some updates here as well. The first one is that residents may have up to 4 visitors indoors at a time. And then next is that homes can make decisions on how many visitors can be coming in for outdoor visits. And so recognizing here, the ministry is not putting on a limit on the number of outdoor visitors coming in, but outdoor space is different for every home. And so having the home say, okay, what makes sense for the number of visitors that we can have? Again, looking to have proper spacing between groups of visitors with the residents as well. As well, with the physically distancing, residents and their visitors do not need to physically distance from each other. And visitors may support residents in the dining room and may also join in activities. We do require, though, just for this one, that visitors must be masked at all times while they are within the home. And so great that they're able to support the residents in the dining room, but they shouldn't be joining in with eating in the dining room with the residents. And that just goes to the higher risk of spread of COVID when people are eating and drinking. Next slide. So I'm going to turn it over to Christine to speak to surveillance testing.
Thank you, Dawn. So in terms of surveillance testing, our requirements for testing staff, caregivers, visitors, that will continue for the time being as one of the protective measures. We did make some updates recently, effective as of yesterday, to the directive on surveillance testing to reflect the most recent advice that we received from the Chief Medical Officer of Health's office. So one of those changes goes hand in hand with what Dawn spoke to in terms of outdoor visits. The surveillance testing for outdoor visits will no longer be required. That was one of the temporary measures that had been put in place because of the Omicron variant. So now what this means is that if you are having an outdoor visit with some loved ones, that visit can begin immediately, and now no need to wait for a test result. We've also made some changes for those who previously were infected with COVID-19, and they have to continue their testing after 90 days of being infected with COVID-19. We had a temporary measure of the testing resuming after 30 days, again, due to Omicron, but now with the more recent evidence, we can resume that at the 90-day mark. Next slide, please. In terms of the vaccination policies, the vaccination program in long-term care homes has really been a great success, thanks to you and your family members and caregivers and the staff that got vaccinated, to protect yourselves and protect one another. And really, it's that high rate of vaccination in long-term care homes and across the province that really help to mitigate the severity of outbreaks and really get us to the other side of the Omicron wave. So in terms of vaccination rates across the province in long-term care, virtually all staff and residents are fully vaccinated with at least 2 doses. For staff, more than 85% of eligible staff now have their 3rd dose. And for residents, many of you have their 3rd and even 4th doses now. And as I said, that's really gone a long way for protecting one another during this most recent wave. And it's with that, and at the stage of the pandemic, that the government can now shift from its previous approach, which relied on a provincial directive and mandate, to providing guidance to homes in terms of their employer-led policies. So with that, the minister's directive on immunization policy has been revoked as of yesterday. But going forward, homes can continue to have their own vaccination policies. And I know we've heard already from a number of homes that have already chosen to do so. As long as the home's requirements are consistent with the Long-Term Care Homes Act, including the Residents' Bill of Rights, and with any other applicable laws. And just the last point on this slide is really just reminding that this shift does not change how important vaccine remains in the fight against COVID-19, especially in reducing severe illness. So we'll continue to encourage everyone to get vaccinated, and we'll continue to support homes to ensure that vaccine remains available and that they can provide vaccination on site for yourselves, for residents, and for staff. Next slide, please. And I believe this is perhaps our last slide before we move over into the question and answer period, but just a reminder of some of the existing supports and measures that will remain in place to ensure a healthy and safe place in long-term care homes. So the infection prevention and control measures are going to continue to remain in place. So active screening before someone enters a long-term care home, the testing, which I mentioned, the masking, which Dawn spoke to, and for staff and caregivers wearing the personal and protective equipment that's needed. So that will all continue for the time being. And with that, I think the next slide, I'm turning it back over to Dee.
Yes, you are. Thank you, Christine. Before we transition to the question and answer portion, please take a moment to let us know who you are by way of answering this poll. While this webinar is intended for the audience of residents, we understand that there may very well be others who have joined us today. So please click all that apply. Are you a resident, residence council assistant, administrator or general manager, government rep, family member, essential caregiver, or long-term care team member, or other? We'll just wait a moment for you to have some time to click on all that apply. And while we're waiting, I just want to acknowledge 2 of OARC's team members who are working frantically behind the scenes. We have Melissa McVie, who's OARC's Director of Education and Communications. And we have Jennifer Langston, who's our Operations and Project Manager. So thank you to both Melissa and Jennifer for all that you're doing right now behind the scenes.
Thank you, Dee. It's Melissa here. I'm just going to give it another moment. We've only heard from about 73% of our audience, so I think responses are still rolling in, but I'll close the poll shortly. We've got a real mix on the line today.
And please continue to send in your questions. We do have a running list of questions that we hope we will be able to address in the remaining time together. We have lots of time for questions. We have well over half an hour, so keep the questions coming in, please. Okay, thank you. So we have residents council assistants. We do have some managers or administrators. We have long-term care team members, and we do have some family members, some essential caregivers, and a couple of government representatives. Thank you. Okay, let's move on to our questions and answers. We do have 3 on the screen right now, but we will be looking into our question and answer cumulative list in addition to these 3. So the first one, just to get us started, why was the vaccine mandate revoked?
Thank you, Dee. So as I was mentioning in the slide, and as Dawn covered in the kind of opening, we're really at a point now in the pandemic where we're seeing the number of outbreaks and the number of cases go down, and that the majority of people who do have symptoms because of COVID-19, they are mild or they're even asymptomatic. So the outbreaks aren't as severe as what we've experienced in the first couple of waves. Having said that, though, we did have some high numbers, over the course of, December and January in terms of number of outbreaks. And so the protective measures at the time were put in place to help try to reduce some of those impacts. But now we're at the point in the pandemic where the government and the Chief Medical Officer of Health feel with the high rates of vaccination in place, both across the province, but also in long-term care homes, as well as the antivirals that are now coming into the province, that we're in a better place in terms of addressing any of the future impacts of the pandemic. And that we can shift from the government mandated vaccination requirements now to homes having their policies in place based on best practice and guidance provided by government. So really the reason why the government is kind of removing its requirements on homes to ensure they have a policy in place is now to give homes the opportunity to have their own policies in place based on the unique needs of their homes and their residents and their staff.
Okay, thank you, Christine. I do see in our question and answer box, there are a number of questions around the vaccine. So we'll continue with the 2 remaining questions on the slide, and then we'll address some of these other topics and questions. What measures remain in place to keep me, person living in long-term care, protected from COVID-19?
So I'm happy to answer this one. And Christine spoke to this a little bit during the presentation, but really there are still measures in place, and it's really just, we remain vigilant that COVID-19 is still out there. And the importance of infection prevention and control measures continuing to be in place. And so you'll hear us often refer to IPAC, and that is exactly what it is infection prevention and control measures. And so that's the public health measures such as washing your hands or wearing a mask. When I spoke about physically distancing. Well, we removed a lot of those measures. We're still looking for some physical distancing in the home, such as between groups, as I spoke to, as well as the surveillance testing and the continued promotion of vaccinations, even with the removal of the mandatory vaccination policy by the government itself. And as Christine spoke to as well, just the proper use of personal protective equipment by the staff members, but also by caregivers and visitors coming into the home. And so still a number of measures in place, and we're really working closely as we do look to what's next as well. And so we work closely with the Office of the Chief Medical Officer of Health, and we also do some consultations with people such as the long-term care homes, but also Dee herself, who sits on our Response and Recovery Advisory Committee to look at, where's the next place for us to go here.
Thank you, Dawn. And that's perfect segue into the third question about looking into the future. What will happen if there's another variant? And I'll just preface that by saying the decision or the way that the Omicron variant has been managed and dealt with is one thing. But what if there's another variant that comes out that is unlike our experience with Omicron?
Thanks, Dee. I can start off, and Dawn, if you want to add. So we work very closely, as we've both mentioned, with the Office of the Chief Medical Officer of Health to monitor all the trends and the emerging evidence related to the pandemic. So that includes what we're seeing here, but also what we're seeing abroad in terms of possible new variants. We also work really closely with them in terms of planning for possible future scenarios. Not knowing, of course, exactly what might unfold and what that might look like specifically. So back in the early fall last summer, we did undertake kind of a planning exercise in terms of different scenarios that could play out over the fall with a new variant, et cetera. And that positioned us to be able to respond rapidly when the Omicron variant did surface in Ontario. So we're also planning for the future possible scenarios, working with the Office of the Chief Medical Officer of Health. And I think now with the high vaccination rates and the antivirals that we have in place, we're in a different place than where we were, 6-12 months ago. And, going forward, and as we have tried to balance, over the past several months, really trying to balance resident well-being and mental health with your safety has been one of our top priorities, and just trying to strike that right balance between ensuring the health and safety measures are in place, but trying to also maximize your opportunities for socializing and being able to have quality of life and enjoy time with loved ones, which we know is just so incredibly important. I don't know, Dawn, if you had anything further you wanted to add to that question.
I think that was pretty thorough. I think I will just add, every wave and every variant has been different, and speaking for the Ministry of Long-Term Care, we learn and are able to adapt every wave that comes along, and unfortunately there's just some things that are unpredictable, but being able to pivot quickly, I think, is an important lesson that we've learned, especially as Omicron came on extremely quickly, and we had to pivot quickly from where we were at, which was very much very few measures actually in place, to really putting things in place quickly with limited information. And so that's something too that we hope to be prepared for as much as we can should another variant occur.
Thank you, Dawn and Christine. I just want to remind everyone, we are seeing some questions appear in the chat box. Can you please refrain from putting your questions in the chat box? You will see a Q&A tab on your screen. Please use the Q&A tab and not the chat. It just becomes very tricky for us behind the scenes, and for me not behind the scenes, to monitor both the chat and the Q&A box. And I'm also seeing that there are a few people who have raised your electronic hand. In order to minimize background noise, we will be drawing the questions from the Q&A box. So please type your questions into the Q&A box. Thank you. I'm going to just jump in and look at some of these questions. One question here from a home in Ottawa. Every resident has the right to have visitors of their choice. Can my unvaccinated family member visit me in my home, which retains the requirement that visitors be fully vaccinated? So that's a discrepancy between the home's policy. They're continuing with the policy that all visitors must be vaccinated. So what are your comments on that?
Thank you, Dee. So homes are able to have vaccination policies in place for their staff and for visitors and caregivers. They can continue their policies, and they must do so though with the Residents' Bill of Rights in mind, and balancing the right to receive visitors with also the right to ensure a safe and secure home. So that's kind of the balancing, striking that balance between those two rights and ensuring that it continues to be a safe place, but also the right of residents to receive visitors. We strongly encourage homes to work with their residents council and their family council for these policies to make sure that there's an opportunity for residents and families to be engaged as part of that process. But homes do have the ability to put in place their own policies.
So identifying that there may be some tension between family members or any visitor who is not vaccinated, what advice, or do you have any advice for resident leaders, residents councils, management teams in their homes to work through this tension?
So I do encourage the residents council leaders and the family council leaders and residents and family members themselves to try to work through this issue with the homes. But where concerns continue to exist, and if individuals feel that homes are going beyond, maybe not complying with the law or going beyond and not complying with the Residents' Bill of Rights, they do have the opportunity to file a complaint with the action line, which I don't think we've included in the presentation, but happy to make sure that everyone has access to that line. And that's an opportunity to lodge sort of a formal complaint, and then an inspector would go and inspect and ensure that homes are complying with the Long-Term Care Home Act, including the Residents' Bill of Rights. So that's one mechanism that they could pursue.
Okay, thank you. There are several questions coming in with regards to activities, specifically eating, consuming of a snack, for example. So I'm going to combine a couple. Why can I not share a meal with my family and friends in my own home? When I leave for a social visit, I can go to a restaurant, I can go to a family member's home for a meal. So why can I not have a meal with them in my own home? And relating to that, if a family member or a friend visits a resident in their home, why can they not enjoy even a cup of coffee together in the privacy of a resident's room, for example? And the other part to that is many activities in long-term care homes involve food. So if cohorting is required for meal times, are activities to occur in homes in the absence of all refreshments. So crafts or social gatherings without snacks, without tea, without coffee, without refreshments. So there's a great amount of concern around intake of food, refreshments with visitors in the privacy of their own room, and then certainly during activities. Could you please speak to those?
Thanks, Dee. All good questions. And I would say with regards to the visitors and the caregivers, I appreciate, just the social aspect of sharing food and how it's very much a part of, I'd say, all cultures, the importance of that. Unfortunately, it is one that the Office of the Chief Medical Officer of Health has deemed to be a higher risk of spreading COVID-19. And so it was, the decision was made that it would be safer to prevent the spread within the homes for caregivers and visitors to be remaining masked and not be eating and dining. And that also applies to staff as well. And so it goes back to the importance of personal protective equipment, including masking, to prevent the spread of COVID-19. And so recognize that, you can go out and you can be with your family and you can eat, but it seems a little different that you can't do that within the home. It's a measure currently in place, as we're easing the measures in place, but trying not to go too full stop where because we don't want to end up in a situation where outbreaks are happening. And so this is just very much a layered approach that we are taking. With regards to the activities and residents, refreshments and snacks happening at those times, the ministry's guidance is clear that it's when dining that cohorting must be taking place. We would leave it up to the homes to make the decision as to whether that would be applicable to social activities or not.
Okay, thank you. Do residents need to be vaccinated to come into the home? So that's a question directly from a resident. So new residents moving into their home, do they need to be vaccinated?
Thanks, Dee. So we've never had any requirements for residents to be vaccinated in the home. It is their choice. However, we do strongly encourage all residents to get vaccinated and to receive their boosters. And residents should generally be offered a vaccine before they enter a long-term care home or shortly thereafter. I also saw a related question around whether vaccines would be offered in the home or whether it would be off-site. So I just wanted to take the opportunity here to say that in the vast majority of cases, the vaccine for residents would be done on site in the home and not having residents have to leave the home to get their vaccine. So there's no requirement for residents, but strongly encouraged.
Will residents require rapid antigen tests upon returning from an absence?
So the requirements for absences comes from the Office of the Chief Medical Officer of Health. At this time, there is still the requirement for testing after an absence, and it really depends on whether you've been on a day absence or overnight, and if it's day absence, the frequency. So we are still, we do still have in place testing after an absence, and that's definitely one of those items that we're continuing to work with the Office of the Chief Medical Officer of Health to see, when is the appropriate time that we can end that requirement.
Okay. I have a two-part question for you again trying to group themes together. It has to do with residents being concerned around staff or team members working very closely with them who are not vaccinated. So two parts to this. Will staff and team members who were let go previously for not having the 2 vaccines be able to come back to work? And secondly, if I am not comfortable knowing that people who provide intimate care with me could be unvaccinated, what recourse do I have if my home decides to say that they will employ people who are unvaccinated?
Thanks, Dee. So on the first part as to whether homes are, rehiring staff that maybe have been let go because of the vaccine mandate, all hiring decisions are really ultimately the responsibility of the home, and they will set their vaccination policies, as we've already discussed, as well as their hiring policies. So there's no, ministry requirement either way. It's really a decision of the home around who they're hiring and what their vaccination policy will be. As we've kind of noted, we do strongly encourage everyone, working and living in long-term care homes to get vaccinated. And then the second part was for those who might feel concerned, if they're in close contact with a staff member who they believe is not vaccinated. Again, I would strongly encourage residents to, work closely with their home in terms of, since it is, the home who is responsible for the hiring practices. And also just as a reminder, staff will continue to need to be tested before they come into work. They'll have to wear their personal protective equipment and masks and undergo daily screening before they enter the home. So those measures will continue to remain in place for all staff.
Okay. Forgive me if I've missed it because I'm trying to attend to a couple of things here. Did you speak to the resident who voiced an opinion around being uncomfortable about receiving care from an unvaccinated team member, and what recourse would they have?
Yeah. So I did briefly. So what I noted though is that we do encourage, if someone is feeling concerns, that they'll need to work with their home and work with their home on those concerns, since homes are ultimately responsible for the hiring and the care of residents.
Okay. Why do outdoor visitors not need to be tested? Residents are still in close proximity with the visitors.
So in terms of the testing, there is a reduced risk of transmission when outdoors. Visitors will still need to be screened before a visit, but we wanted to remove some of the additional kind of testing burden on homes, on visitors, on staff. And so by given the lower risk of transmission outdoors, we thought that was one safe measure that we could kind of wind down at this point in time.
Okay, what are the testing requirements for residents who return from hospital?
I don't have my notes up on that one, so apologize, but I believe if they're returning home from hospital, it's being tested either before they come home or directly after they come home, and they're isolated until they have received a negative result. That would be for residents who have 3 doses of the vaccine, 3 or more.
Okay. So I see some questions around cohorting, that residents do not need to be cohorted, but what about PSWs, essential caregivers, and other staff? Do they need to remain cohorted?
So there's still a requirement that, as best as possible, that staff do remain cohorted. We recognize that every home is different, and in some homes it's just not possible for staff to even be cohorted, especially the smaller homes. So we do try to have the staff still cohorted. With regards to caregivers, there's never been a cohorting requirement in place.
Okay. Does a resident have to be isolated, example for meals, if he or she has been out to the community for meals or absences? So again, speaking to when a resident comes back into the home after an absence, what is the process that resident should expect?
So if they've been out on a day absence, there is no isolation or quarantine requirement unless the person is feeling symptomatic. If they're out on an overnight absence, they would need to follow what we spoke to the last time we met, which was the guidance from the Office of the Chief Medical Officer of Health to the PHUs, and it would vary depending on the length that they've been out and their vaccination level status.
Okay. On the topic of testing, questions coming in around the frequency that staff and team members are to be tested. Are they required to be tested prior to their shifts? And is it every shift? Is it a couple of times a week? And related to that, we have heard from, I'm not seeing it right now, but we have seen in the past some concerns around team members who arrive for their shift, are tested, and then begin their shift before the test result comes back. And in some cases have to leave the floor once they've begun working with residents because their test 15 to 20 minutes prior to has in fact indicated a positive result. So the frequency of testing for staff coming in, and whether they need to be tested prior to their shift, and if there's a delay in, or do they need to receive the result for their test before they start their shift.
Thank you, Dee. So for staff, students, and volunteers, they are required to get tested at least 2 times a week. So we set a minimum requirement. Some homes go above this. So it's at least 2 times per week. And if they're not fully vaccinated, so for example, as someone who has a medical exemption, it's at least 3 times per week. And that is done at the beginning of their shift. They are permitted to enter the home with the appropriate PPE to begin their shift. They don't have to wait the 15 minutes for their results in order to begin their shift. For caregivers, the family caregivers are also tested at that same frequency, the 2 to 3 times per week as a minimum. Some homes, again, might go above that. Similarly, caregivers are permitted, according to the minister's directive, they can enter the home and proceed to the residence room with appropriate PPE. However, for visitors, any general visitors, they must wait for their test result before the visit can resume. So there are slightly different rules depending on kind of the category of individual.
Okay. Continuing with the testing issue, residents are wondering if they're allowed to just perform the rapid antigen test instead of the PCR and the rapid antigen test.
So testing during an outbreak is really up to the public health unit. The PCR test is the superior, better test. And up until Omicron hit, it was always just the PCR test requirement for residents. Omicron, we ran into problems of the tests were taking too long. We, with the number of people getting tested, and the lab capacity just wasn't there. And so that's why the rapid antigen test was brought in as a measure to make sure that we weren't unduly, you know, that we had the better results, so that we could react properly to it. So it's likely, and it's again something that we are reviewing with the Office of the Chief Medical Officer of Health, that we would actually see the ending of the rapid antigen test, not the PCR test, for the residents when it comes to an outbreak, or absences or admissions as well.
Okay, thank you. A couple of questions I'm seeing now, and I also, we also at OARC heard from some residents prior to today's webinar around the young visitors, young children under the age of 5. We've been receiving mixed messages on whether or not they are allowed in the home. If the home has decided to keep a vaccination policy that all visitors, including all children, must be vaccinated, therefore eliminating the opportunity for children under 5 to visit. What is allowed, who has the authority here in these situations?
So for visitors, as we already kind of spoke, a home can have their vaccination policies for their staff and for their visitors. When it comes to children under the age of 5 who are not yet eligible for vaccines, while we did have a temporary measure in place because of Omicron that did restrict their ability to visit, the ministry has updated its guidance document, which is now online as of today. We did send PDFs last week through the email, but it is available now online, to clarify that the home's vaccination policies are not to apply to children under the age of 5, since they are not yet eligible to vaccination, or not yet eligible for the COVID-19 vaccinations. So going forward, those under the age of 5 should be permitted to enter a home to visit with their grandparent or their loved one.
Okay, why leave the vaccination decision up to the individual home. It's very frustrating to live in a home that is overlaying or maintaining stricter measures despite the opening up in the community.
I can completely appreciate this question. There is, broader government direction in terms of the stage of the pandemic and the response of the government in terms of providing direct mandates or requirements related to vaccinations, and feeling that now we're at a stage of the pandemic where sectors can and organizations can implement and maintain their own policies. So it really is a shift in how, because of where we're at in the pandemic now, moving away from kind of strict government mandates to homes and organizations being able to develop and implement the policies that work best for their home and for their staff and for their residents. So we do, as mentioned earlier, we do encourage homes. We have been encouraging homes to work with their residents' councils, to work with their family councils, to engage with their legal counsel and their labor partners in their policies going forward.
Okay, we do have a few more minutes. Thank you, everyone. There are a lot of questions here. This one talks about the scientific data that has been used to make some of these, or to make these decisions. It has been proven that the vaccine effectiveness wanes after 2 to 3 months. So why was the vaccine mandate revoked? It seems that this decision was not based in science.
And this is one I wish I had my colleagues from the Chief Medical Officer of Health here with us to answer some of the more scientific questions. But based on our conversations with them and the evidence that we've seen, we have seen a waning that does begin a few months after a vaccine is taken, and especially after the second dose, seeing little to no protective effect 6 months after that second dose. So for anyone who received 2 doses of vaccine over 6 months ago, that protective effect against infection, against symptomatic infection, begins to wane. There continues to be significant protection, though, in terms of against severe outcomes and severe illness, even with that second dose. And then that third dose really provides that added boost to the immune response. So, especially with the Omicron variant, seeing that added protection with the third dose. Really, the decision around, so it's not so much that we're as government saying that all homes should remove their vaccination requirements. That's not what we went out and said last week. It was that the government mandates would be removed and that homes now have the flexibility in terms of employing their policies and following the evidence and making decisions based on the unique needs of their homes.
Okay. Again, many people are commenting around mixed messages and differential experiences for residents and who has the ultimate authority. Some public health units seem to be, or regions seem to be indicating that residents do still need to be cohorted. So can you address that? And then ultimately, who has the authority and what recourse do residents have if they feel that the restrictions are over and above and too severe?
So I'm happy to speak to this one. Unfortunately, there's not really a straight answer as to who has the authority. There's many different situations, and it's within those situations where who has the authority might differ. So, the Ministry of Long-Term Care sets out minimum requirements, and with those minimum requirements, everybody is expected to follow those minimum requirements. Homes may choose to go above those requirements, and we've really stressed with the homes the need to engage with the residents' council, the family council, as well as the local public health unit if they are going above and beyond the ministry's minimum requirements. To make sure that all voices are being heard, and hopefully to not have homes putting in place restrictive measures for something that might not be a necessary reason. With regards to the local public health units, they too have a fair amount of authority. And, it's important that they do have the authority because they have the regional lens. While we are seeing overall across the province that the numbers have decreased and we are seeing the recovery, there's still pockets within the province where we're actually seeing the numbers rise. And so a public health unit might be watching that closely and say, okay, we recognize the ministry has lower requirements across the province, but as we are watching these numbers, we've decided that we need to be a little bit more strict because of these rising numbers within the local community. And it's really not possible for the ministry to have that lens as we're not on the ground, and it wouldn't be possible for us to say, okay, well, Thunder Bay, we're seeing a lot of cases, so these are your rules. And Toronto, we're not seeing a lot of cases, so these are your rules. So to help with that, it's the local public health unit that does have that authority at the regional level. We do try as much as possible for consistency in working with the local public health units. We ask the local public health units to report into the Office of the Chief Medical Officer of Health, as well as our office, to let us know if they are putting in place measures that might be above what the ministry's minimum requirements are. And as I mentioned earlier, when an outbreak occurs, the authority is completely with the local public health unit.
Okay. We have time for just a couple of more questions, and I know you've spoken to this, but there are many questions around the practicalities of the rule, around family members, essential caregivers not being permitted to even have a sip of water during the time that they are in the home. So this one specifically is, I'm an essential caregiver, and it appears that I'm still not allowed to eat or drink anything while I'm visiting my person's room or visiting my person, even though I can sit 6 feet away from him. As an out-of-town visitor, I visit for approximately 6 hours at a time, 1 day a week. Add the travel time, and that's a long time to go without even a sip of water. Is this rule not at all flexible?
So we've asked homes, and it's within our long-term care COVID-19 guidance document to homes, to have a designated place where caregivers or visitors who are in the home for a long time may have a place to have a meal, have a drink, or any of those things. But we are requesting that it be a designated space away from where the residents are for that.
Okay. If a resident comes into contact with a positive COVID staff member, how long does the resident have to stay in quarantine if the resident doesn't have any symptoms?
So the quarantine requirements aren't based on whether or not people have symptoms. And it's more based on testing results. It's not a straightforward answer as to you've been in contact with a staff member who has COVID. There's a number of different factors that come into play, such as was the staff member in full PPE. Ultimately, though, that would be in an outbreak situation, and so it would be the public health unit who would make the decision. And again, it's very dependent still on the resident's vaccination level or status as well.
Okay, thank you. We are at 3:30. I think I'm going to turn this back over to Christine and Dawn to finish up and mention how to contact them. Go ahead, please.
Sure, thank you so much, Dee. Firstly, thank you very much for the opportunity to answer your questions today and to present. We do hope to be able to do more of these going forward when there are changes such as these that impact you and let you have an opportunity to connect with us directly. We're also very happy to respond to any questions that you want to send to us by email. So the email address is there on your screen. If there's any questions we didn't get to today, or over the course of the coming weeks, if you have any questions, or if you want to raise any concerns with our policies or questions, please feel free to email us, and we'll respond as soon as we can. We do respond to all emails that come into that account. Dawn, did you have any last words you wanted to say?
I think you covered it. Thanks, Christine.
All right, thank you very much.
Well, on behalf of OARC and the residents that we seek to serve, thank you for this last hour together. I'm sure you can see and feel and read that there are some tensions between what is being decided and the lived experience of residents. So talking about it, getting clarity, figuring out next steps forward is very, very important. So I just want to thank you for this opportunity, and we look forward to the next opportunity to have an audience directly with you. Residents council leaders, please have these discussions in your home, have these discussions with co-residents, with your management teams, with your family members. Absolutely appreciate that these are difficult conversations to have. And in addition to reaching out to the pandemic response branch, we do encourage you to continue to reach out to OARC as well, so that we can move forward, having a really good confident sense of what's happening in your homes. So thank you. We wish you a good afternoon, and until next time, bye for now.